Here you can see me walking in and introducing myself to the patient. I then move the curtain for patient privacy and grab some hand sanitizer for hand hygiene. I then gather all my material for the procedure, and then I go to the computer and check the physician's order and the MAR to make sure they match. I am now checking for the patient's name and date of birth and checking it with the MAR. I then go over to raise the head of the bed, and you can see me asking the patient to please move their head over away from the dressing. I then grab some more hand sanitizer for hand hygiene. And now I am grabbing a pair of clean gloves so I can take off the dressing. Now I am grabbing a mask to cover my face. I am now going to remove the dressing. I hold my thumb onto the catheter and pull towards it, making sure not to rip any skin and not to remove the catheter itself. And now I throw away the dressing in a biohazard bag. Now you can see me inspecting the surrounding area around the catheter to make sure there's no infiltration or edema or rips or tears. Now I remove my clean gloves and prepare to actually clean and redress the catheter. You can see me going over to get some more hand sanitizer to perform hand hygiene because you can never be too safe. Now I am opening up my kit. I first grab the sterile gloves, opening carefully, maintaining sterile technique. Now I don on these sterile gloves, ensuring sterile technique. And now that my sterile gloves are on, it's time to set up my sterile field. I first put down the sterile sheet, and now I put all the contents inside the kit onto the sterile field. I am now going to clean the catheter site using back and forth motions, including the tube. And throwing it away. I now am reaching for the adhesive. I tear it open and apply it all over the area with my sterile hand, avoiding using my clean hand. and not breaking sterile technique. Now we wait for 30 seconds for it to dry. Now it is time to put on the Tegaderm. Now I am removing my sterile gloves and discarding them, as well as removing my mask. Now I'm performing hand hygiene once again because again, you can never be too safe. Now it is time to label with date, time, and initials. Now I am cleaning up my mess. Now I am making sure the patient's call light is in reach, lower the bed, and ask the patient if there's any questions.